अस्सलाम वालेकुम। कैसे हैं आप लोग? उम्मीद है ठीक होंगे। आई होप यू आर ऑल फाइन. Let's start. I want to continue with the lecture that I left with in the last video. So in the last video we started with the face, scalp, temporomandibular joint, and I broke the video to continue with these regions. The parotid region is the temporal fossa, infratemporal fossa, and pterygopalatine fossa. So these are the things that I left for the video, next video. So here I am. I'm Dr. Mohammed Ali Rabbani, Assistant Professor of Anatomy, and I'm here to discuss with you these topics: parotid region, temporal fossa, infratemporal fossa, and pterygopalatine fossa. So this was originally designed as one session. So we started with face, scalp, and temporomandibular joint, and now we're going to start from this point onwards: parotid region, temporal fossa, infratemporal fossa, and pterygopalatine fossa. So before diving into the parotid region, this is the topic I want to give a little background on. This topic is temporal fascia. These terminologies are used very liberally when talking about the parotid regions and especially the temporal and infratemporal regions. So let's dive into that. There are two fascia that are given the name of temporal fascia. There is temporal parietal fascia, that is the superficial of the two layers, and there is temporalis fascia or temporal fascia. If you want to keep things simple, always when thinking about the topic, think in the terms of superficial and deep. But in the books, in the notes, if you're not given the words, be very vigilant that if the book, the notes is talking about superficial layer, it will be talking about temporoparietal. And if the word temporalis is used or the word simple temporal is used, we are talking about the deep temporal fascia. So let's go from inside out. The temporal fascia, the temporalis fascia, the deep temporal fascia. It is the one that is attached to the it is the basically that one that is covering the temporal muscles. So it is attachment. It's like near that of the temporalis muscle. Temporalis muscle was attached to the inferior temporal line. This fascia is attached to the superior temporal line, and here it goes down and it attaches to the arch of the zygomatic bone, zygomatic arch. It is attached to that. Before attaching to the zygomatic arch, it is split into two facial layers, superficial and deep. So there is a little cavity created between these two layers that is on the top of the arch. It contains a few structures that we will discuss. So this cavity, it's not so important as itself, as it contains a penetrating branch from superficial temporal artery that is called the middle branch or zygomatico temporal branch, and then the zygomatico temporal branch of maxillary nerve. These are the ones that are going inside, and this fascia after continuing with the zygomatic arch, it goes down and it forms the two layers of the parotid glands. Let us see in this particular picture. This fascia, temporalis fascia, deep temporal fascia, in this particular picture is shown in the light blue color. This is the point where my pointer is. This is the point where temporalis fascia, deep temporal fascia, it is attached to the superior temporal line. Above it, it is continuous with the periosteum of the cranium, pericranium. We follow below it. It is covering the temporalis muscle, so we call it temporalis fascia. Just above the zygomatic arch, it is divided, split, and it is attached to the outer and inner margins of the zygomatic arch. These two split layers, they continue down to the inferior margin of the mandible. These two layers go all the way to the inferior margin of the mandible. And these two layers are basically making the capsule of the parietal gland. So there is the outer facial layer, there is the inner facial layer. Both are actually coming from temporalis fascia. Here it changes its name. The outer aspect, it is called parotidomesteric fascia because on the back aspect it is covering parotid. A little anteriorly it is covering the mesenteric muscle. So it is parotidomesenteric fascia. It is split into these two names. And there is deep layer and they join at the lower margin of the mandible and they go to the hide bone. Do you remember this fascia? So this is basically the whole extension of the investing layer of deep cervical fascia. If you remember from the lecture, from the second lecture of neck, we talked about the investing layer of deep cervical fascia that was covered attached to the inferior margin of the mandible, and it enclosed between its two layers two glands, parotid gland and the submandibular gland, along with the two muscles that were on the back. So this is that extension. So if you follow back, that is the suprasternal space, superficial layer, investing layer of deep cervical fascia attaching to the hide bone, coming to the mandible, splitting to form the two layers of the parotid gland, parotidomesenteric fascia, attaching to the zygomatic bone, above the zygomatic bone becoming the temporalis fascia, attaching to the superior temporal lines, forming the glea aponeurotica. Sorry, please ignore glea aponeurotica. It is to form the conjoint tendon, and it continues up as the pericranium. So this is temporalis fascia. Then there is temporoparietal fascia, the one that is above it, that is superficial to it, that is shown in the red brown color here. This is the one that is superiorly, it is attached to the temporoparietal layer. The same temporoparietal fascia is attached to the same conjoint tendon. That is why it's the name conjoint tendon, because this is the point at the level of superior temporal lines. There is attachment of both the deep temporal fascia and the superficial temporal fascia. Above it, it is continuous with the glea aponeurotica, the aponeurosis between the frontal and the occipital belly. Below it, if we follow it, it is the temporoparietal fascia. This is the superficial temporal fascia that covers the outer aspect of the temporalis fascia, the deep temporal fascia. As we move back down, there is as we move down, there is zygomatic arch. It passes lateral to it. Then it passes on the lateral aspect of the cheek. This here includes superficial musculo-aponeurotic system. So here it includes a lot of the smooth muscles, the skeletal muscles that are covering the face. So this become merged with that. So this is superficial musculo-aponeurotic system, and downwards it continues with the platysma, superficial fascia, the superficial fascia of the neck, including the muscle platysma. So this is about the uh, facial layers. So this is the continuation we just talked about. A quick revision: the superficial temporoparietal fascia, the superficial temporal fascia. If we look upwards, it's the continuation of glea aponeurotica, conjoint tendon, temporoparietal fascia, superficial musculoaponeurotic system, and the superficial fascia of the neck containing platysma. And the deep temporal fascia, it above downward, it consists of pericranium, conjoint tendon, temporalis fascia, deep temporal fascia, the two layers covering the parotid gland, and the investing layer of deep cervical fascia. So this is about the facial layers, and these terms will be frequently used as we move along to the regions. So let's talk about the parotid gland. Parotid gland is the salivary gland, the largest of the three in size, and it is present right here. It is present in front of the ear. It is present below the zygomatic arch. It is present lateral to these muscles. This is anteriorly there is masseter and posteriorly there is digastric. So it is present at this area, just in front of your ear, just below the zygomatic arch. It is present right here, going all the way below the angle of the mandible. So this is the parotid gland, and there is an accessory parotid gland may also be present here. It is shown in the picture right here. This is the accessory parotid gland shown here. It When present, it is usually present parallel and above the parotid duct. So we will talk about parotid duct shortly. So SSA parotid gland, it's a little unimportant in the sense it is not present in all of the people, but if present, it is present above and parallel to the parotid duct, and with many small openings it opens into the parotid duct of Stenson. And this parotid duct of Stenson, as it moves across the buccinator muscle opposite to the upper second molar tooth, it carries the saliva to the oral cavity. Now let's talk about the relations of the parotid gland. On the lateral aspect of the parotid gland, it is covered by skin, superficial fascia, and investing layer of deep cervical fascia. That here it is called the parotidomesenteric fascia, divided into the parotid part posteriorly, mesenteric part anteriorly, and actually it should have been here this particular point. And between the superficial, this is basically superficial fascia is actually superficial muscular aponeurotic system that is on the top of the deep fascia. Okay, so this fascia, this parotidomesenteric fascia, it is penetrated by the it is penetrated by the branches of facial nerves, the branches of the facial nerves, the temporal, zygomatic, buccal, mandibular, and the cervical, as they move across the anterior edge of the parotid gland and to the surface, to the muscles. So this parotidomesenteric fascia is penetrated by these nerves. The second thing to remember about MCQs, it's this: it is supplied by greater auricular nerve. This is the nerve that supplies the inner and outer aspect of the parotid gland. These both layer of fascia, and these are the ones that are stretched during mumps. Mumps is the inflammation. In the mumps, there is an inflammation of parotid gland, parotiditis occur. And when it expands, the fascia that is covering the parotid gland, it stretches, and this nerve, greater auricular nerves, carries sensation in the mumps. That's an important question asked historically. So not carries mumps, uh, carries simply, you understand, carries pain in mumps. Not, it's not a transmitter. It carries pain in mumps. Okay, let's talk about the surfaces, its relations. When cut in a transverse section, the parotid gland can be seen to be divided into three surfaces. The one that is laterally, that we just talked about, it's related to the skin, superficial fascia, and deep fascia. The superficial fascia was the parotidomesenteric fascia. The deep fascia was the smooth. The superficial fascia was the smooth SMAS, superficial musculopeneurotic system, and the deep fascia was the parotidomesenteric fascia. This was the lateral aspect. Medial aspect is divided into two parts. This part, that is the anteromedial, we will be talking about it as the anteromedial surface, and this part that will be talked about as the posteromedial surface. This is anteromedial, this is posteromedial, and this will be the lateral surface. So these are the relations, are the surfaces across which the relations are studied. To just talk about the lateral, let's talk about the anteromedial and posteromedial surface. Intermedial surface, as you can see, if you have followed the lecture of the temporomandibular joint, you must know that the mandible, the ramus of the mandible, it's sandwiched between two muscles on either side. On the outer aspect, there is masseter muscle, the one that you can palpate right here while clenching your teeth. And on the inner aspect, running in the parallel fiber direction, is the medial pterygoid muscle. Both are the muscles of mastication and both have almost similar functions that includes the closing of the jaw and protraction of the jaw. So you can see these three structures are related to the anteromedial border. What else is related to the enteromedial border are the things that are exiting the parotid gland. That includes this parotid duct of Stenson that is exiting from this surface, enteromedial surface on the surface of masseter, and these five branches of the facial nerve: the temporal, zygomatic, buccal, marginal mandibular, and ultimately cervical branches. They are exiting from the medial aspect, enteromedial aspect. And there are some branches of the external carotid artery that are exiting to go to the face, that are exiting especially the maxillary nerve, maxillary artery, superficial temporal artery. They are exiting from this surface. So these are the enteromedial relations. So here these are enteromedial relation, and I would like to just mention here the parts of the parotid glands also. The part that is on the surface will be the superficial part, and this part that goes beyond the bones, that goes beyond the mandible here and the mastoid process, and it is the deeper one, that is the deep part. And when we are talking about the deep part, this is the deep part, and that this is the superficial part, but there is no very great anatomical breakdown between the part. There is no functional breakdown between the part, so we usually don't mention it, but there is a terminology used: the deeper part of the mandibular, the parotid gland, and the superficial part. We are talking about this, the part that is outside the bones, that part that is present inside the bones between the mandible and the mastoid. And when we talked about the enteromedial surface, we have just talked about both of them. Here we have talked about whole of this surface. Posteromedial surface, now we are talking about this. The easy way to remember is that remember the bones. Here is one bone, mastoid process. Here is a second bone, styloid process. So the easy way to remember is the mastoid process with the attached muscles and the styloid process with the attached muscles. The mastoid process, it gives attachment to the two muscles. We studied them in the first lecture of the neck. That was one, a large muscle, strap like muscle going like this, sternocleidomastoid, and the other one that was going like this and up to the mandible like this, that was the digastric muscle. The posterior belly of digastric and sternocleidomastoid will be related to it, and then styloid process and the three muscles that are attached to it, the three muscles and the styloid process that are attached to it, along with the styloid ligament, that is called styloid apparatus. That is called styloid apparatus. That includes the styloid process, the muscles, plus styloid ligament. So this is the styloid apparatus. So this is related to the posteromedial surface. So it will include the styloid process, the attachment of the hide, the stylohyoid muscle, styloglossus muscle, stylopharyngeus muscle, and stylohyoid ligament. So this is a long list that we have covered, and then the structure that is left is just beyond the styloid ligament, just beyond the styloid ligament, about here, at roughly here, like this area, about there is the carotid sheath. So we can say that parotid gland is separated by from the carotid sheath by the styloid process, carotid sheath and its contents. So in this way, that can be mentioned in the posteromedial relations of the parotid gland, because that's just related posteromedial to the stylohyoid muscles and styloid apparatus. So we talked about mastoid process and two attached bone muscles, styloid process and three attached muscles, one ligament, and just medial to it the carotid sheath with all of its contents. There are jugular vein and common carotid internal jugular artery at this level, internal carotid artery at this level with the vagus nerve, and we are left with the structures that are entering the parotid gland. We talked about the exiting fibers of the facial nerve branches and the exiting fibers of the external carotid artery branches. So they have to exit somewhere, and this is this surface. The facial nerve is exiting here, and the external carotid artery from down upward coming upwards, it is entering from this posteromedial surface. So these are the structures that are related to the posterior surface, posteromedial surface of the, these are attached to the posteromedial surface of the parotid gland. So here some of the things can be seen here, especially the relation with the digastric and the sternocleidomastoid, and to see the relationship for the deeper structures, that is styloid and the other structures, we have to go to the cross section. That is a cross section at the level of C2 axis vertebra, and here you can see the things. Don't be overwhelmed by the picture. I will break it to you. So this is the parotid gland right here. This is the parotid gland right here. I will shade it. This one, this one will be the anteromedial surface. This one will be the posteromedial surface, and this one will be the lateral surface. On the anteromedial surface, you can visibly see here the sandwich of the mandible with on either side. On the inner side there is medial pterygoid, on the lateral side there is masseter. Talking about posteromedial surface, we can't see the styloid process at this particular level, but we can see, let me remove some of the things that I can, but what we can see, we can see the two muscles that were attached to the styloid muscle. So these are the two muscles that are attached to the mastoid process. This is sternocleidomastoid on the outside and posterior belly of digastric on the inside. Then we can see the styloid apparatus, not actually the styloid process, but the three muscles right here. We can see the stylohyoid, we can see the stylopharyngeus, and we can see the, which we are left with, styloglossus muscle. And you can see that just beyond that, you can see the carotid sheath with all of its contents. That includes the internal jugular vein, common carotid artery, and the last three cranial nerves. Not exactly last three, cranial nerve number 9, 10, and 12. Cranial nerve number 11 becomes separated very early on. So this is all about the relations of the parotid gland, the anteromedial relations, the posteromedial relations, and the posterior relations of the parotid gland. Structures passing through the parotid gland, that includes the facial nerve itself and its branches, that forms the pes and serinus. We talked about in just the part 1 of this lecture. Then there is pes and serinus, that is, then there comes the vein, that is the retromandibular vein, that ultimately forms, go down and divides anterior posterior division, and anterior one will join the facial vein and the posterior one will join the posterior auricular vein to form the external jugular vein. Then there is external carotid artery, and not shown here, here in the deeper aspect will be the associated lymph nodes. Here will be the lymph nodes. So these are the structures that are present in the parotid gland from the outside to inside. And here, when talking about the structures present in the parotid gland, it is good to know that parotid gland is divided by surgeons into the superficial and deep parts by the plane created by the facial nerve plexus. The part that is superficial to the vein are nerves, and the part that is deep to the nerves. Anatomically speaking, the parotid gland, it's not divided. It is a single integral gland, serous gland, integral gland, that is complete inside out. So this is more like a surgical landmark than an anatomical division between the two. That is a point to be remembered here. So this is the facial nerve, and the superficial and deep lobes divided by the facial pes and serinus. But the point to remember is this is a surgical landmark. This is not an anatomical division. There is no actual difference between the two parts. Parotid duct of Stenson. This is the anterior border of the parotid gland. Just beyond it, there is a medial intermedial surface. So it emerges near the anterior border from the intromedial surface. It crosses on the surface of the mesenteric muscle. Then, as it comes to the anterior margin of the mesenteric muscle, it turns inside. It turns inside and it crosses, it pierces this muscle that is the buccinator muscle, the cheek muscle. Here in the Netter's picture, this part is shown, curved cut is shown here. It crosses the mesenteric muscle, it crosses the buccinator muscle obliquely, and it opens inside the second upper molar tooth. This is molar 1, this is molar 2, and here is molar 3. So it is opening right here, just across the second molar tooth. So this is the parotid duct of Stenson. Buccinator, you have to remember, it is crossing the masseter muscle and it is piercing the buccinator muscle. And the third point that you have to remember, it is opening across the second upper molar tooth. And if there is a bleed, you can see from here. And surface anatomy, it is very interesting to see. If you look at your ear, there is tragus, and between this and this, there is intertragal notch. This point, between that main tragal point here, antitragus, tragus, and between them there is tragal notch, and this point midline, this is called philtrum. If you make a line between these two lines like this, the parotid duct is present in medial one third of this line. And if you clench your masseter muscle and you place your finger, you may actually be able to palpate the parotid duct. At here, this is the parotid duct and this is the surface anatomy. So because it's a superficial structure, it is not covered by any muscle. It is prone to surgery, especially prone to injury, especially during surgeries or the lacerating injuries on the head and neck. And sometimes there is a tumor of the parotid gland, not a very common tumor, and it's when present, it's very malignant, and when it grows, it includes the facial nerve itself. So it can lead to the facial nerve palsy, and even if it does not, the surgery to remove it may and usually includes the removal of the facial nerve. The bacterial infections that can occur to the parotid gland and parotid duct, they may be due to the recurrent infection. There was an infection in the oral cavity, there was some infection going on, and the infection went back through the opening inside the cheek, and it went back and infected the duct and gland via blood, like in case of mumps, and it leads to a very painful, when parotid glands try to swell, it gets tight and pressurized inside its capsule, and it gives a very painful swelling. And it is present on the masseter, it is present around temporomandibular joint. So any movement for talking and chewing will lead to excruciating pain, and these pains are carried by greater auricular nerve. And then there is Frey's syndrome. It happens when in the parotid gland there are two nerves that are very near to one another. There is auricular temporal nerve, the one coming from mandibular gland, mandibular nerve coming across the neck of the mandible into the parotid gland and in front, passing in front of the ear. And then greater auricular nerve, the sensory nerve from the cervical plexus that were coming right here. The greater auricular nerve was sensory, and it was this was supplying the sweating areas, the sweat glands and skin of the area over here, over the angle of the mandible. Auricular temporal one was on the other hand carrying the parasympathetic fibers that will activate the parotid gland. So if there is an injury, surgery on this area, and both of these nerves get damaged, there is a chance that fibers of one nerve grows into the other one. So when you are eating, so what happens is that auriculotemporal nerve that is responsible for salivation mixed up with the greater auricular nerve that is responsible for sweating. So what happens is that if these get mixed up, the lines get mixed up among one another. When you taste something tasty, the signals parasympathetic fibers that are meant to actually create salivation now lead to sweating because these fibers are mixed with one another. So this mixing of fibers that is called phrase syndrome, and it usually occur after the injury in this region. Arterial supply of the parotid gland comes from the external carotid artery. The venous supply, the venous drainage, it's going to the retromandibular vein. In the lymphatic drainage, it is going into the pre-auricular group of lymph nodes that are the deepest structures present in the parotid gland. Nerve supply, don't worry, it's a little crowded slide, and I will be discussing, you will get an detailed idea of what I'm talking about during the cranial nerve session, because then we would have traced the cranial nerve all the way back from the brainstem to the gland here. But here you for the sake of memorization, some of you will pick it. uh, the supply consists of the parasympathetic component, sympathetic component, and sensory component. Every visceral structure is supplied for these supplies. The parasympathetic supply is a little tricky. The parasympathetic supply, it is supplied by the auriculotemporal nerve, but the originating fibers are coming from the glossopharyngeal nerve. So the originating fiber are coming from glossopharyngeal nerve. They come from the glossopharyngeal nerve, and from the glossopharyngeal nerve, they enter the middle ear. This is called tympanic nerve. In the middle ear, they form the tympanic plexus, and in the tympanic plexus, they exit it into the middle cranial fossa as lesser petrosal nerve. It then goes through the foramen ovale and it reaches the otic ganglion. I know it's a little tricky, and I know it may not be very easy to memorize it right now, but just listen to it. We will go through this again, inshallah, when discussing the cranial nerves. So, the presynaptic, the first order neuron, the presynaptic, the preganglionic cell body, it is present in the brainstem, in the medulla, in inferior salivatory nucleus. It exits with glossopharyngeal nerve. It exits with glossopharyngeal nerve, and with glossopharyngeal nerve, as it comes down to the infratemporal fossa, it enters the middle ear through tympanic nerve. Tympanic nerve, I am having a little trouble in recalling which foramen it enters through, but it may click, I will tell you. It enters the middle ear to supply the tympanic plexus. From the tympanic plexus, it exits as lesser petrosal nerve that comes to the middle cranial fossa. In the middle cranial fossa, it goes over the surface, over the upper surface of the petrosal bone, and it comes down through the foramen ovale along with mandibular division of trigeminal nerve, and it comes down and relay in the otic ganglion. Otic ganglion is present just near the mandibular division of trigeminal nerve. This is where the second order neurons are present. This is where the postsynaptic, postganglionic neurons are present. It synapses with that, and the postsynaptic fibers, then they move along the auriculotemporal nerve to the parotid gland. Anatomically speaking, here is the lesser petrosal nerve shown in the middle cranial fossa coming down through the foramen ovale to the otic ganglion, and from the otic ganglion, its fibers jump to the auriculotemporal nerve, go back, turn around the mandibular head, mandibular neck, temporomandibular joint, and outside, just outside, it is present parotid gland. It supplies that. So this is the route of the sympathetic fibers. I have summarized it right here. Parotid gland and sympathetic fibers, they, in the last lecture of the neck, we discussed about the sympathetic plexus that was running, and the plexus, it was forming around each of the arteries. So a similar plexus is around this artery that is known as the middle meningeal artery, that goes to the foramen spinosum. So there is a similar sympathetic plexus from the external carotid artery on the maxillary artery on the middle meningeal artery that is going all the way up, and the fibers from these sympathetic fibers from this jump to the auriculotemporal nerve, and they go through the auriculotemporal nerve to the parotid gland. And again, the auriculotemporal nerve is the one that carries back the sensory fibers back to the mandibular nerve, and it gets back to the skull, it gets back to the brain through this uh, trigeminal nerve. So this is what the nerve supply of the parotid gland. So here it is, parotid gland. Let me take a 2 minute break right here. I have 10:47, 7:47 right here. We will continue at in 7:50. Meanwhile, if there are any questions, please mention in the chat comments here. Welcome back. Um, just get me a few things sorted here. Yes. Okay. So the next topics. Now the next three topics are the fossae, the temporal fossa. Then we will discuss the infratemporal fossa. And after that, we'll discuss the pterygopalatine fossa, and then we will close for the day. Temporal fossa. This is this area shown in the green here. Let's trace its boundaries. So it is above and behind. It is demarcated by this dotted line. That was simply the superior temporal line. So upper aspect it is the superior temporal line, and posterior aspect it is a superior temporal line. To be more accurate, it is technically the line of fusion of deep temporal fascia, the temporalis fascia. So the space it's closed by the fusion of the temporal temporalis fascia into the skull. So this is the enclosing space. So and that of course line of fusion is the temporal line, superficial temporal, superior temporal line. So where this, then in front there are the bones. There is the frontal bone right here and the zygomatic bone right here. And if we are able to look a little down, there will be maxillary bone. Let me show you here. So in the here you can see in the front there will be frontal bone. There will be frontal bone. There will be zygomatic bone, and there will be a little part of the maxillary bone also. But very little part, the major part will be the rest of the two bones, the zygomatic bone and the frontal bone. Below this part, the medial aspect and the lateral aspect, let's talk about that. First, we have done above and behind, the front, the below, the roof. And just let's first do the roof and the floor. The roof in this case, it's the medial wall. This is the the floor is the medial wall. This is the floor. The floor will consist of pterion. We talked about it in the skull in the first lecture, and the four bones that are around it: the frontal bone, parietal bone, squamous part, temporal bone, greater wing of sphenoid. And in between them there is pterion. This is the part that is prone to fracture, and this is the part that demarcates the location of the anterior division of the middle meningeal artery that is passing just below it, and the breakage of this part will lead to the damage of middle meningeal artery and epidural hematoma. And this is the part that leads to the compression of prefrontal gyrus, the motor area, because the sylvian point, the point where the lateral sulcus joins the central sulcus, it's just beneath this pterion. This is about the floor, and the roof will be this fascia. The roof will be this fascia, the temporalis fascia, the deep fascia, that will be the roof. So we have done anterior, posterior, superior, medial, lateral, and we are left with below. We are left with the structure below. Let me, okay, let me give me a second. Okay, uh, I have a skull here, and let's remove the jaw. Let's remove the teeth, and let's remove the jaw. And okay, so we are left with skull. So this is temporal fascia. Oh, sorry, temporal fossa. We talked about the anterior wall. We talked about the medial wall containing four set of bones. These ones. Then we talked about the other superior, this line, posterior, this line, and we talked about lateral and non shown in the picture, and then we are left with inferior. Inferior is a little tricky. Inferior one, it consists of this opening. If we look at here from the below, you may be able to appreciate this line that is present right here, this line that is present right here. So at this line, you can see this line, the greater wing of sphenoid, it makes a very sharp angle. Below it, it is almost in a horizontal plane. Above it, it is like this. So this is this line, like this. So this line, the red line, that is the infratemporal crest. This is the greater wing of sphenoid in the temporal fossa, forming the floor of the temporal fossa. And here is the greater wing of sphenoid, the part that is making the roof of the infratemporal fossa. So this is the one thing. The other thing that we can see here, it's this zygomatic arch. Let us get somewhere here. So medially, it is labeled by the infratemporal crest. Laterally, it is labeled by the zygomatic arch, and between them there is an opening that helps for the free communication between temporal fossa here and the infratemporal fossa there. So infratemporal fossa here and the infratemporal fossa there, like this. It will come like here. So this is about the inferior margin. So this space, this is the inferior end of the infratemporal temporal fossa, this area. So let's move back to the presentation. Okay, so inferior one, the below, zygomatic arch on the lateral aspect, infratemporal crest on the medial aspect, and opening between the two that makes the direct communication between the two fossae, and that is the opening through which the temporalis muscle is coming down to get attached to the coronoid process. Contents between the bones and the fascia, it consists of temporalis muscles and the vessels and nerves that are supplying them. So it consists of temporalis muscle. It is containing a pair of temporal artery. It is containing a pair of temporal nerves. There is an artery coming from the superficial temporal artery. This one shown from coming from outside. To be clear, these arteries coming from the temporal, these are branches of maxillary arteries. So there is an artery coming from the outside. This is the branch of superficial temporal artery. This is called middle temporal branch, middle temporal artery. And there is also zygomaticotemporal nerve that is coming outside from zygomaticotemporal foramen. If I hope you remember the zygomaticotemporal canal and zygomaticotemporal foramen. We talked about zygomaticotemporal here in the orbit. The going to the face is the zygomaticofrontal, going to the back temporal fossa is zygomaticotemporal, and we can trace it back all the way back here. You can see right there. This one. This is the zygomaticotemporal opening that includes the zygomaticotemporal artery and zygomaticotemporal nerve exiting back into the temporal fossa. On the surface, on the fascia, in the superficial fascia, the superficial temporal fascia, there are running structures that includes the two of the five branches of facial nerve. That is the temporal branch, that is the zygomatic branch, and in the back, the sensory nerve, not shown in this picture here, includes the auriculotemporal nerve. And of course, there are accompanying artery, that is superficial temporal artery and vein. So these are the structures that are crossing the superficial temporal arch. And these are the structures that are adhered to the fascia superficially, and these are the structures that will get damaged when there is a fracture right here or a surgery right here of the zygomatic arch. So these are the structures that are passing superficial to the temporal fossa. That brings us to the end of the temporal fossa. We can move on to the next topic. The next topic is infratemporal fossa. Infratemporal fossa, as you can see by the name, it is the one that is below the temporal bone, infratemporal fossa. It is also known as parapharyngeal space. It is also known as lateral pharyngeal space when talking about the skull. We're talking about the same thing. Let's look at its boundaries. Let me set up a few things here. just one thing. Okay. If you have been with me from the last lecture, we use this model when talking about the muscles of mastications. So let's remove a few things. Let's remove a few things and see where it gets us. I am removing this temporalis muscle, buccinator muscle, masseter, lateral pterygoid, two heads. Let's remove them and let's remove mandible itself. Let's remove medial pterygoid and stylomandibular ligament. Okay, it brings us to here. There is removal of the yes. Okay, let me get back to the presentation. I think it will be simpler here. Okay, boundaries. Um, 1 minute. Let me set up the tensor. Will I give me a minute? I will set up a few things and then we will continue from here. Okay, just a second. You have been so patient with me. Just one more second. Okay, I am taking you back to the skull, the 3D model of the skull. Let me get it back. Okay, so here we are, the same model of the skull, the same area that we discussed before. So here let us see the bony landmarks. So this is the area that we are going to define. Let me show you by the markings. This is the area that we are going to define. This area is the infratemporal fossa. Infratemporal fossa. This is the infratemporal fossa. Let's make up the boundaries of this area. Okay. When you look at the front, this is the front, anterior aspect. Anteriorly, it is related to this bone. This is the maxillary bone. This is making the anterior end of the infratemporal fossa. If you climb up this bone and get to the upper aspect, you will see this opening right here. You will see this opening. This is the inferior orbital fissure. This is known as inferior orbital fissure, and this is basically the lateral aspect of inferior orbital fissure. You can see from the here also, here you are looking into from this point onwards, from there you are looking to the infratemporal fossa, and you can see the same opening all the way from the back. This is the here you can see the inferior orbital fissure. So this is the anterior wall. Maxilla, the posterior aspect of maxilla, and superiorly the gap between the maxilla and the greater wing of sphenoid, and this gap between these two bones forming the infraorbital fissure. Let's trace the medial wall. The medial wall from front back, it consists of a little of the maxilla, then there is this is the major bone that is on the medial aspect, that is called the medial pterygoid plate. A little point at the lower end, this is the pyramidal process, and then there is no bone in the back. There is a muscle that is called superior constrictor muscle. I will show you right here. So the superior constrictor muscle is making the floor here. Not only that, on the top of it, there is a set of muscles that is called, there are two muscles, both are going to the palate. There is tensor villi palatini and there is levator villi palatini. So these are the muscles that are on the this is all of the structures that are present in the medial aspect of the pterygopalatine fossa. We saw the maxilla, we saw lateral pterygoid plate, the pyramidal process, the two muscles going to the palate, tensor and levator villi palatini, the superior constrictor, and it ends back at the level of this styloid process. So this brings us to the posterior end. Styloid process is the posterior end. Below, it does not have a very clear boundary. It goes and becomes continuous with the neck. And superior aspect, it is the same as we talked about in the temporal fossa. So superiorly, we have this part. Superiorly, we have this part, number one. Number two, this part. These are medially. This is the greater wing of sphenoid. This is the part of the temporal bone and the suture between them. Then at this margin here, this is the infratemporal crest, point number 3. Let's look at them. This is the roof of the infratemporal fossa, and lateral to them, the fourth point will be the this zygomatic arch. This will be the fourth point, zygomatic arch, all the way to the here, and the fifth point will be the gap that is present between them. That will be the fifth point. So these are all the structures that are making the roof of the infratemporal fossa. Almost the same structures, those were making the floor of the temporal fossa. So this is about the infratemporal fossa boundaries. Let's get back to the presentation. So here you can see medially it is made up of lateral pterygoid plate, tensor villi palatini, levator villi palatini, and superior constrictor, and there is maxilla in front, and there is pterygomaxillary fissure. Okay, I did not show you that. Let me get back to this. So this is this space, this one. This space is called pterygomaxillary fissure that is going into the pterygopalatine fossa. Laterally aspect, there is the ramus of the mandible cut here, covered with the muscle, that is medial pterygoid muscle, and on the upper aspect there will be coronoid process. Roof, medially it will be made up of greater wing of sphenoid, the squamous part of the temporal bone, the suture between them, and the infratemporal crest. The laterally it will be zygomatic arch, and between them there will be the opening that communicates the two fossae, the supratemporal and the infratemporal fossa. In the terms of contents, it's a very big topic. It contains the deep part of the parotid gland. The part, by the deep part here, I mean the part that was passing behind the ramus of the mandible and in front of the mastoid process and going inside. It contains then parts of the parotid gland. It contains 3 out of the 4 muscles of the mastication. The two muscles that were discussed here, the medial pterygoid with its two heads, the lateral pterygoid with its two heads, and the inserting last portion of the temporalis. Coming to the coronary process. Of course, masseter muscle is outside. There is arteries, maxillary artery and its branches. There are a lot of branches of maxillary artery. We will be going through them in this lecture. These are about 15 branches of the maxillary artery, about 10 in the infratemporal fossa, about 5 in the pterygopalatine fossa. And then there are nerves. There is mandibular nerve with all of its branches. Accompanying it, there is otic ganglion. Coming from the middle ear, there is cauda tympani, and there is from the pterygopalatine ganglion, there is coming out of nerve, that is the posterior superior alveolar branches. Let's look at them. We talked about the muscles, three muscles, the arteries. I will go through these branches again. I'm not going to tell you the branches in this particular slide. The veins, these veins are not as well defined as the arteries. They sort of jumble up into forming a large plexus known as pterygoid plexus, and it is connected to the skull above, it is connected to the face and orbit in front, and it is connected back to the retromandibular vein through maxillary vein. The point to be remembered is it is present around pterygoid muscle, lateral pterygoid muscle. We will discuss that. And then there is veins, a lot of veins. There is a branches of the mandibular vein, there is otic ganglion, there is cauda tympani. Let's jump into them one by one. Okay, ignore this picture. This is our first topic, maxillary artery. First, let's discuss where is the maxillary artery, where does it originate, where does it end. When talking about the name of the artery, it originates from the point it bifurcates from the bifurcation of the external carotid artery. This is one of the two terminal branches of the external carotid artery. So it originates within the substance of the parotid gland as the external carotid artery divides into the superficial temporal and the maxillary arteries. It moves all the way through the infratemporal fossa. It crosses the lateral pterygoid muscle, and then the muscle is removed right here and it enters this pterygopalatine fossa, this particular part, this region. It enters pterygopalatine fossa, and it is giving branches all the way. We will discuss the branches immediately after discussing this. And then it enters the orbit as infraorbital artery, that it enters the orbiter at infraorbital artery. So this is where the name ends. So the maxillary artery name started right here when it branched from the external carotid artery, and the name ended here when it enters the inferior margin of the orbit, so infraorbital fissure. So this is the maxillary artery. It is divided into three parts. Let's discuss that infraorbital artery first, get it out of the way. Infraorbital artery, it's the continuation of maxillary artery. It runs in the floor, it enters the infraorbital canal, and it comes on the front of the face through the infraorbital foramen, and we saw that in the arteries of the face. So this is the infraorbital artery. Let's discuss about the maxillary artery and its branches. The maxillary artery, it's divided into three parts. The part one, that is from the origin to before the lateral pterygoid muscle. So this area, from the origin to before the lateral pterygoid muscle. The part two, that is going across the lateral pterygoid muscle. The artery may be running lateral to this and medial to this, and different atlases have made it differently. Netter's atlas I'm using right now, it has made it lateral to the lateral pterygoid muscle. The Grant's atlas, the one that is present in the Keithel Moore, that is present in the Moore's clinical anatomy, it has drawn it medial to the muscle. So don't get confused by that. It is a normal variation that it may be present on either side. And the third part is one that after crossing the lateral pterygoid muscle, it is inside the pterygopalatine fossa. That is the third part. So there are three parts. Each of the three has three set of muscles, three set of branches. Sorry, Sorry for that. It has three parts: before the lateral pterygoid, at the medial pterygoid, after the medial pterygoid, that is the Pterygopalatine fossa. Each part has five branches. Five branches. An interesting way to remember is that part 1, five branches go to the bony foramina. They all go into the opening of the bones. There are five branches. Number 2, second part, they all go to the muscles. Part 3, they are in the Pterygopalatine fossa. So we will read them about in that topic, Pterygopalatine fossa. Here I will be discussing about these two set of 5 and 5 branches. The 5 branches going into the bony foramina in the first part, and the 5 branches going into the muscles. So here the first part. The first part, a major artery shown right here, it is going down into the jaw, into the mandible, that is the inferior alveolar artery. It moves down, enters the mandibular foramen, run along the inferior alveolar nerve and run along in the canal to supply the lower teeth. And it has a branch that comes out, the mental artery. From the mental foramen, it comes and exits out and supplies the area in the chin. This is one branch. To see the other branches, we have to go deeper. There are two branches, you know their name very well. You have read about the skull, you know about the foramen of the skull and the structures that are passing between them. These are the true branches that are going to supply the meninges. There is middle meningeal artery right here, and there is accessory meningeal artery right here. They are opening into these foramina. The middle meningeal artery was entering the skull through foramen spinosum, and the accessory meningeal artery, it is entering the skull through foramen ovale. So we are done with three branches. We have done inferior alveolar artery. We have done inferior alveolar artery that was going into the mandible. We have done this one that was going into the mandible. We have done two meningeal arteries, the middle meningeal artery and the accessory meningeal artery. And this is the point of interest of an exam. Look at this point, it is running between the two roots of auriculotemporal nerve. So this question is very interesting and asked when talking about the auriculotemporal nerve, the mandibular division of trigeminal nerve, or when talking about middle meningeal artery. So this question gets asked. And then we are left with two branches, branch number 4 and 5. These are the branches that will go to the ear. These are the branches that will go to the ear, number 4 and number 5. One will go to the anterior aspect of eardrum, one will go to the posterior aspect of eardrum. So there is the one that is going to the anterior will be the anterior tympanic, because it is going to the anterior aspect of eardrum. The one that is going to the posterior aspect, its name, it's a little different, that is deep auricular artery. It is present deep in the external auditory canal, external auditory meatus. I know it's too much, but just for the sake of completion of notes, I will mention that they enter the openings. Through which openings? So the anterior one, it is entering through this fissure between the petrous bone and the tympanic part, that is petrotympanic fissure. And the one that is going on the back aspect, shown here, it is moving between the squamous part and the petrous part, temporal part. It is called squamo. tympanic. So here they are both entering the parts. So here we are done with the first part of the maxillary artery. Okay, let's dive into the second part. Let me clear all the ink on the slide. The second part. The second one part we talked about, it was supplying all the muscles. So which muscles were there in the infratemporal fossa? There was lateral pterygoid, there was medial pterygoid, and there was inserting point of the temporalis muscle. So let's apply these muscles. The muscle supplying the lateral pterygoid, artery supplying the lateral pterygoid, the artery supplying the medial pterygoid right here. Simple. And the two arteries supplying the temporalis muscle. They go through that opening and they go to the temporal fossa to supply the temporalis muscle. So we have covered 3 out of the 4 muscles of the mastication. We have covered the lateral pterygoid, we have covered the medial pterygoid, we have covered the temporalis. We are left with which muscle? We are left with mesenteric muscle. The artery that supplies the mesenteric muscle, it's shown here in the cut section. The mesenteric artery, it moves to the lateral wall just above the upper end of the mandible ramus through the mandibular notch between the coronoid and condylate process. It moves through that notch and enters the deep aspect of the masseter muscle. Here the cut end is shown here. This is the mesenteric artery. That's it. We are done with the second part of maxillary artery. When discussing the second part, just think about it is supplying the muscles. Which muscles? Think about the muscles of mastication. Just remember these names and you will fill the complete list. The two branches are going to the temporalis muscle, there is a branch going to the lateral pterygoid, there is a branch going to the medial pterygoid, and there is a branch going to the masseter. That's it. That's simple. So congratulations, you have completed one of the most difficult topics regarding the arterial supply, the maxillary artery. Okay, maxillary artery, its relationship to the sphenomandibular ligament, it's asked sometimes as it moves from the parotid gland to the front infratemporal fossa. It is near the neck of the mandible, in the upper part of the ramus of the mandible, between the mandible on the lateral side and the sphenomandibular ligament on the medial side. And sometimes you are asked the questions which structures are related at this level. So superiorly it is related to the auricular temporal nerve, and inferiorly it is related to this inferior alveolar nerve. So this is the question that gets asked sometimes. The nerves, there will all the same branches will be present. There will be the two branches coming from ear. There will be two tributaries coming from the anterior and posterior aspect of the tympanic membrane. There will be tributary coming from this inferior alveolar nerve. There will be emissary veins coming from the foramen spinosum, foramen ovale, especially through foramen ovale, and there will be all the supply back from the muscles, or 5 of them, and they are not very well defined as arteries, but they will join to form a plexus that is called pterygoid plexus. It may be present inside or outside the pterygoid muscle, and as you chew, the pterygoid muscle expands and contracts, not exactly with when it contracts, it shortens its length, its belly swells up, and then this pterygoid plexus is pushed and released. So it acts as a peripheral pump, just like you talked about peripheral pump in the lower limbs when talking about the veins around the soleus. So it's a peripheral pump. It is connected everywhere. It is connected superiorly to the cranial cavity and the sinus is there. It is making its connections through to the cavernous sinus, through foramen ovale, through foramen lacerum, and even through foramen spinosum. The connections are going anteriorly. It is connecting to the orbit, the infraorbit ophthalmic vein. It's connected here. It is connected to the veins of the nose through sphenoparietal foramen, through palatine fossa, and through this vein, the deep facial vein. It is connected to the veins of the face. That brings us back to the danger area of the face. This area is connected through ophthalmic veins to the cavernous sinus, and lower area it is connected through the pterygoid venous plexus to the cavernous sinus. So this is about the pterygoid venous plexus. Then we are going to discuss the mandibular nerve. Don't worry, I will discuss the especially the mandibular nerve topic. The mandibular nerve topic I will discuss again with the trigeminal nerve, and I will trace all of its division with its branches. But let's discuss it here also. My focus will be to identify the nerves and to see where does they go in the cranial nerve. In the component, I will be focusing also on which components like parasympathetic fibers are going there, only sensory and motor fibers are going there. So I will be discussing that in the cranial nerves, but let's focus on the cranial nerves, which can be seen right here. So the mandibular division, it is coming down from the middle cranial fossa into the infratemporal fossa through this opening, foramen ovale. It has it as it exits, there is a main trunk, main, then it divides into the anterior division, and it divides into the posterior division, and we will see the branches of them separately. There will be three branches from the main trunk, there will be three branches from the posterior division, and I think there will be three or one from the this region also. Let me consult my notes very quickly so that I don't record anything that I would regret later. So there will be three branches from the there will be branches from the main trunk. Let me open my notes. Give me 1 second. There will be branches on the okay. Let's talk about the main branches. I like the mnemonic. Like you taste something funny or something tasty, you said, mmm. So this is the mmm. This is the mnemonic for the main trunk. So the main trunk, this gives rise to a mandibular branch, and it gives rise to a nerve that is going to the medial pterygoid. It giving rise to the this meningeal branch and the nerve that is going to the medial pterygoid. This medial pterygoid you won't be able to see it from the lateral aspect. You have to dive into the medial aspect. So here it is shown here, medial pterygoid nerve, this one. It is the one that arises from the medial aspect of the mandibular nerve. It passes through the optic ganglion and it supplies nerve, medial pterygoid muscle. Apart from it, it will supply the two muscles which have a name tensor in them, which have the name tensor in them. Which are the two muscles? Tensor. They have both have names tensor in them. There will be tensor villi palatini and there will be tensor tympani. The muscle that is supplying the tensor of the palate and the nerve that is supplying the tensor of the palate. So it is basically the branches of this nerve, the branches of the nerve that is coming from the medial pterygoid nerve. So here you can see actually the nerve that is going to the tensor tympani, the nerve going to the tensor villi palatini. It is shown right here. They may arise as a separate branches, but they usually arise from this parent nerve, that is the medial pterygoid nerve. That is medial pterygoid nerve. So we just discussed the main branch, the main trunk of the mandibular nerve. The mnemonic I discussed was mandibular main trunk has meningeal branch that goes back through the foramen ovale and supply the area, and sometimes it does rise in the higher up in the meningeal area in the middle cranial fossa, and it does not have to go up. And the second one was medial pterygoid nerve that is supplying the medial pterygoid muscle. Along with it, it is supplying the two muscles which have the name tensor in them, the tensor villi palatini and the tensor tympani. So this is the main trunk of the mandibular division. Okay, let's move to the anterior. Anterior is the one that has mostly, I'm using the word mostly, muscular. Again, what was the muscles in the infratemporal fossa? These were the muscles of mastication. Have we covered any muscles of mastication in the main trunk? Yes, we have covered the medial pterygoid. So what we are left with? We are left with three muscles. We are left with temporalis, we are left with lateral pterygoid, we are left with masseter. So let's find them. Again, the word mostly I used, there is one sensory nerve also. So this sensory nerve would be the one that is a sensory supply, that will be the buccal nerve. Let's follow these nerves and let's find these nerves. Okay, the one that are going to the temporalis muscle, these are called temporal nerves, anterior and posterior. The one that is supplying the lateral pterygoid nerve, it's a very small nerve, it's originating and just supplying the muscle, that is pterygoid nerve. So we did deep temporal nerve, we did lateral pterygoid nerve, and then the third motor nerve is shown in the cut section right here at this point. This is called masseter nerve. It will go laterally, it will go over the mandible, it will go through the mandibular notch, and it will supply the mandible that is outside the ramus, the masseter that is outside the ramus. That is the masseteric nerve. Three muscles. Then we are left with the fourth nerve, that is the sensory nerve, that is the buccal nerve. It will be covering the surface of the buccinator, and please don't be confused, it is not the motor nerve supplying the buccinator, it is the sensory nerve supplying the top of the buccinator area. So it exits the infratemporal fossa by moving between the two heads of the lateral pterygoid, and as it moves out, it goes to the lateral aspect of the cheek, it runs over the surface of the buccinator and supplies the skin over it, and it penetrates the muscle to supply the mucosal membrane on the inside. So there are four branches we discussed. One of them was sensory, three of them were motor. These were a pair of temporal, these were masseter, these were lateral pterygoid, and the sensory one was buccal nerve. Okay, there are variations. Sometimes the two temporal nerves arise independently. Sometimes the second temporal nerve arises as a part of buccal nerve. Sometimes the lateral pterygoid nerves arise as a part of buccal nerve. Sometimes one of the temporal and the masseter nerve arise from a common tree. So these are the different things that we just discussed. So we are done with the anterior division that was mostly muscular. It has one sensory supply nerve and all of them other was motor. Then we are left with posterior division. If we said that anterior division was mostly motor, we will say that the posterior division is mostly sensory. Again, the word mostly is there. So it has three branches. You have read the names already. One is auriculotemporal, the other is inferior alveolar, and the last one is lingual. Don't worry, we will be discussing them again when talking about these in the cranial nerves, but let's follow them here also. Auriculotemporal nerve. It arises from the posterior aspect. This is a very important thing to remember. It is arising from two roots, and these two roots are embracing the middle meningeal artery. They go back, curve around the temporomandibular joint, and they move up in front of the ear opening just behind the parotid gland, and supply goes up. It supplies the parasympathetic, sympathetic, and sensory supply to the parotid gland. It supplies the sensory area to all of this temporal region. Let's keep it aside now. So we have just talked about auriculotemporal nerve. Let's talk about now the lingual nerve. It is not very much included in this topic, but we have to discuss it, the chorda tympani nerve. I'm not I don't want to discuss in detail the root of the chorda tympani nerve, technically speaking, but I will give a very quick summary. Chorda tympani nerve, it's a branch of the facial nerve. We're talking about chorda tympani nerve. It's a branch of the facial nerve that has gained access to the middle tympanic cavity, middle ear, and from there it enters anteriorly petrotympanic fissure. Through petrotympanic fissure, it is coming into the infratemporal fossa. It is very important because it is carrying the fibers for the taste of anterior two-thirds of the tongue, and it is carrying the fibers from the salivary glands, the two of them that are remaining, that is sublingual and submandibular gland. So carrying these fibers, the taste and parasympathetic fiber of salivary gland, it enters the infratemporal fossa and it merges with the lingual nerve. Before the merging, the lingual nerve, the trigeminal nerve is the lingual nerve was purely sensory. It was going to supply the general taste sensation to the anterior two-thirds of the tongue. But due to this chorda tympani, it is now having the fibers of the parasympathetic fibers to the salivary gland, and it is having the special fibers that are going to sense the taste. So that is how the lingual nerve is gets to carry all of these fibers. So lingual nerve, it moves down, it supplies the two glands. There is a ganglion here, some mandibular ganglion just above the ganglion. It is hanging from the gland. We will talk about the connections of the ganglion in the cranial nerve section, and we will talk about it in the oral cavity a little bit, and it goes on to supply the oral cavity. So it supplies these two glands, submandibular, sublingual glands, and it supplies the tongue through the fibers that were originally coming from the trigeminal nerve. It will be supplying the general sensations, and through the fibers that are coming through chorda tympani, it will be getting the taste sensation anterior two-thirds of the tongue. With the last nerve, we are left with the last nerve, that is inferior alveolar nerve. This is the only nerve that has some motor component. It has some motor component. This motor component separates early on as the inferior alveolar nerve itself. It enters the mylohyoid it enters the mandibular opening and mandibular canal in the ramus of the mandible just beyond, and it continues to run inside the mandible and supplying the teeth. Its cutaneous branch comes outside as mental nerve, and its other branch continues onwards to supply the lower teeth. So this is inferior alveolar nerve. But you can see before it enters the canal, the bony canal, it gives rise to this nerve. That is the nerve to mylohyoid. That is the nerve to mylohyoid. So this is the motor component. This is the only motor component of the posterior division. It goes down, and as you can see, it is going to supply the mylohyoid muscle. It is going to supply the mylohyoid muscle and the muscle that is just superficial to it, that is the digastric muscle, anterior belly. So this is all about the supply of the anterior division of the trigeminal nerve. So that brings us to the end of the discussion of the mandibular nerve. We talked about its main trunk giving rise to two branches, the meningeal branch and the branch to the medial pterygoid. And in the medial pterygoid, we added the two muscles with the name tensor in it, tensor villi palatini and tensor tympani. Then we discussed the anterior division. We talked it was majorly muscular, supplying the rest of the three muscles, that was lateral pterygoid, temporalis, and masseter, and one sensory supply, that was buccal nerve, that was sensory nerve. Then we talk about the posterior division, that was majorly sensory, having the auriculotemporal nerve going back and above to the front of the ear to supply the parotid temporomandibular joint and the temporal region. The inferior alveolar nerve going down into the mandibular canal, supplying the lower, all of the lower teeth and giving out this mental nerve. But before going so, it was giving out a motor nerve, that was mylohyoid nerve, that is shown here. And in the last, we talked about the lingual nerve that received the chorda tympani, and after gaining the superpowers from the chorda tympani, it went on to supply the anterior two-thirds of the tongue and the two of the three remaining salivary glands. So that brings us to the end of the infratemporal fossa. Okay, the last topic but not the least. You have bared with me for so long. I really thank you for that. This is the last topic, that is the pterygopalatine fossa. Pterygopalatine fossa, it's the space between the pterygoid plates and the palatine bones in front. So, this is pterygopalatine fossa. There are two words that are usually coming together. That is pterygomaxillary fissure, and there is pterygopalatine fossa. If we consider this fossa as a 3D space, if we consider this fossa as a 3D space like this 3D space itself, this is pterygopalatine fossa. The If you look at this cube, if you look at this structure, the anterior surface that is facing yourself, this 2D plane, this thing, only this surface, not the rest of it. This plane, this curtain, this is called, you may have guessed it, pterygomaxillary fissure. So what we can say that you actually, when entering the pterygopalatine fossa, you pass through the pterygomaxillary fissure to gain access to the inside of the cube. So this is this fissure. This is the pterygomaxillary fissure. So it is known as pterygomaxillary fissure because this is defined by the and posteriorly by the common root of the pterygoid plates and the posterior margin of the maxilla. And in between them, there is pterygomaxillary fissure. You pass through this fissure and you enter the cavity inside. That cavity is called pterygopalatine fossa. So, which structures are related to it? On the upper aspect, there is superiorly, there is body of sphenoid. If you move down, you will see the part where the pyramidal process of palatine bone touches the maxilla. So it closes down. So there is a pyramidal process of palatine bone inferiorly. Medially, on the medial aspect, you will see the one in red, the perpendicular plate of palatine bone, and the little bone, yellow part that is part of sphenoid bone, but majorly the part in red that is the pterygoid plate. Perpendicular plate, sorry, not pterygoid plate, the perpendicular plate of the palatine bone. It has two processes. This one going towards the orbit, this one going through the sphenoid bone. So it is orbital process and the sphenoidal process. And these structures, the orbital process, the sphenoidal process, and the sphenoid bone, it is making this opening, sphenoparietal foramen, that is making the communication of this fossa to the nose, to the nasal cavity. On the lateral aspect, we are left with this space, this fissure, the pterygomaxillary fissure, and then we have just to say about the anterior wall and the posterior wall. I will change the slides here. The anterior wall is made up of maxilla, the posterior surface, and above it you can see this opening, this gap. This is the infraorbital fissure. What this the fissure that we talked about in the infratemporal fossa? Yes, that's the same fissure. This fissure on its medial aspect, it's opening to the pterygopalatine fossa. On its lateral aspect, it is going to the infratemporal fossa. Posteriorly, it is made up of majorly it is made up of the pterygoid process containing pterygoid canal, and above the greater wing of sphenoid that is containing foramen rotundum. It is shown here. Foramen rotundum shown here, and the palatovaginal canal, it is shown. Pterygoid canal and palatovaginal canal, they are shown here in the root. These are the foramina that are forming at the posterior aspect. Okay, if you're not confused enough, I will do a little from the 3D model. So this is the fossa. Let me remove the zygomatic bone. This is the zygomatic bone. Let's remove it. So here we can get a better access to pterygopalatine fossa. This is the space. Superiorly, it is forming the here. There is a palatine bone, and here superiorly it is ending by the sphenoid bone. It is not very clearly shown here. Okay, so this is the body of the sphenoid bone, this thing, the green area that contains the opening of foramen rotundum. Posteriorly, there is this pterygoid plate. Medially, there is this palatine vertical plate of the palatine bone containing this opening, that is a sphenopalatine opening. Anteriorly, there is maxilla. You can see the palatine bone and the maxilla are overlapping a little here. I can fade palatine, oh, sorry. I can fade palatine bone here, and if you can see maxilla, they are overlapping a little bit. In between them, there is a canal running that is containing the greater palatine vessels. And if you can see up here on the upper aspect of the anterior wall, there you can see the infraorbital fissure. And below the opening, this area is closed by the point where pyramidal process of the palatine bone fuses with the posterior aspect of maxilla. So having talked about all of the boundaries of the pterygopalatine fossa, the contents include the third part of the maxillary artery with its 5 branches. I will discuss it. The corresponding veins, maxillary nerve, it is having a very short course in the pterygopalatine fossa. It is coming from middle cranial fossa through foramen rotundum entering the Pterygopalatine fossa in its upper aspect and immediately exiting from the infraorbital fissure into the orbit. As soon as it crosses the infraorbital fissure, it gets out of the Pterygopalatine fossa, and there, just like the infraorbital artery, it continues into the infraorbital canal as infraorbital nerve. So this is the only small part that we are going to discuss. The major branches that are we will discuss at the branches of the medial, the branches of the maxillary nerve are not directly arising from the maxillary nerve. The maxillary nerve, it's attached to this ganglion here. This is known as pterygopalatine ganglion. So all of the sensory branches, these are basically emerging from this ganglion, the pterygopalatine ganglion, going to the orbit, going to the teeth, going to the nose, going to the palate, going to the pharynx. So all of these branches are basically coming from pterygopalatine ganglion. We will read them as their part. Let's first discuss the maxillary artery. The third part of the maxillary artery. It is a very small area right here. It is giving two branches to the back. One is in the pterygoid canal. Let me highlight the arteries with red here. There is the artery of the pterygoid canal. There is the artery of the pharyngeal canal, and there is the artery of the sphenopalatine foramen. So this is the artery that is going to the pterygoid canal. We will discuss in the cranial nerves. Pterygoid canal was the one that was bringing in the sympathetic and parasympathetic fibers to the pterygopalatine ganglion. Not going into the detail, it was coming from foramen lacerum to all the way here. So this was that nerve to the pterygoid canal. Then there is pharyngeal artery. This one was the nerve to the pterygoid canal. Then this one will be the nerve to the pterygoid canal artery, and then artery to the pharynx. It will go back and open into the nasopharynx. That will be the artery of the pharynx, the artery of the nasopharynx, and then the artery going to the nose, the sphenopalatine foramen. I'm not going into the detail in the exact branches that are supplying the nose. There will be some branches that are going into the medial wall. Some branches will curve around the roof to go to the lateral wall. We will discuss this in the nasal part, the respiratory system. And there will be the arteries that are going down between the palate and maxilla down to the palate. The artery that is going anteriorly, that will be the greater palatine artery, and there will be the lesser palatine artery supplying the soft palate, and there will be greater palatine artery supplying the hard palate. And then we are left with infraorbital branch. It's not technically a branch, it is simply a continuation of the infraorbital artery. Sorry, it's a continuation of the maxillary artery. And the last artery that we had to discuss, let me highlight what we have discussed so far. And we are left with this artery. We'll discuss this, and then we are left with this artery, posterior superior alveolar artery. This artery is a little different from the rest of the arteries because it does not exit from any foramen into the pterygopalatine fossa. It exits through the pterygomaxillary fissure on the lateral aspects and enters the infratemporal fossa. So this is the artery, the posterior superior alveolar artery, that you will read as the content of the infratemporal fossa. It will exit the pterygomaxillary fissure. It come to the posterolateral aspect of the maxilla, and it will make openings into the bone and go on to supply the posterior upper teeth, that are the molar teeth. So that is about the maxillary artery. And then the maxillary nerve. Let's do it from the schematic diagram. The maxillary nerve itself, it is very having a very short course in the pterygopalatine fissure, pterygopalatine fossa. It is entering the pterygopalatine fossa through foramen rotunda, passing through the upper aspect and exiting out. Technically speaking, it gives four branches here. The two, these ones, These are the sensory roots that are going to supply the pterygopalatine ganglion. We will discuss the ganglia and the cranial nerves also, but keep in mind every ganglion we will read in the head and neck will have a sensory root, will have a sympathetic root, will have a parasympathetic root. So the connection of the maxillary nerve, it's the sensory root of the pterygopalatine ganglion. Then it is a separate branch here. This is the zygomatic nerve. This zygomatic nerve enters the orbit separately from the maxillary nerve as zygomatic nerve through inferior orbital fissure, and it gives rise to zygomatico-temporal branch and zygomatico-facial branch that we saw in the supply of the face. We will follow them further in the orbital cavity and we will summarize them again in the cranial nerves also. And another one of the direct branch is this posterior superior alveolar nerve. It has the similar story with the artery of the corresponding name, that it exits the pterygomaxillary fissure, comes out to the posterolateral aspect of the maxilla, and it continues to supply the upper teeth. And then there is infraorbital nerve, that is basically the continuation into the orbit. The rest of the branches that we hear of the maxillary nerve are coming from the pterygopalatine ganglion. They are carrying the sensory fibers from the maxillary nerve, but they are not necessarily arising independently from the from the maxillary nerve itself. They are arising from the pterygopalatine ganglion. The pterygopalatine ganglion contains a sensory connection from maxillary nerve, and it has a common sympathetic and parasympathetic root. That root is called the nerve of pterygoid canal, the nerve of the pterygoid canal, and we will discuss what is behind it again in the cranial nerves. It is from the facial nerve, from the geniculate ganglion of the facial nerve, there is coming the greater petrosal nerve. Through the internal carotid artery, sympathetic plexus, coming the deep petrosal nerve. They are joining to form the nerve of pterygoid canal. In the foramen lacerum, it enters this canal and it exits to form the pterygopalatine ganglion. And here they are exiting through the same foramina from which the arteries were exiting. So there will be a nerve going into the palatovaginal canal to the pharynx. There will be a nerve going to the nasal branches to the sphenopalatine ganglion. There are multiple nerves going to the nasal branches, but let's leave them at nasal branches because the veins, the nerves that are going into the lateral wall are different from the nerves that are going into the medial wall. The nerves that are going into the inferior orbital fissure, that will be the orbital branches. The nerves that are going down to the palate, that are called palatine, greater palatine and lesser palatine. And this is the picture that you will see mostly, and you will see a picture like this in the models for OSPI. So here you can see the pterygopalatine ganglion with the two connections to the maxillary nerve. It's receiving the nerve of the pterygoid canal. It is giving the pharyngeal branches, palatine, greater and lesser palatine branches, the nasal branches, the orbital branches, and then the maxillary artery itself is shown to give the posterior superior alveolar nerve and the zygomatic nerve, further dividing into the temporal and facial branches and the infraorbital nerve. So that's it. That was it. That was so simple. And please forgive me. I have gone into a little detail, a little depth in this topic after I have completed my complete cycle in the head and neck with this detail. I will try to come back and form a rapid revision series also, but I'm leaving this now for anyone who is interested in getting a better detail. I will be breaking up all of these videos into small chapters and you can access any topic that you have that you want to access. And I have labeled almost all of my pictures with the small tags at the bottom. The pictures are from the last anatomy, the Netter's Atlas, the Gray's Atlas, the Grant's Atlas. Some pictures are from Snell, and the 3D model that I have been using was Complete Anatomy by 3D4 Medical. Thank you so much for listening. Thank you for being with us. If you have any questions regarding the topic, and any suggestions regarding my teaching method, any feedback, please do mention in the comment below. Inshallah, I will try my level best to get back to you and solve your queries. And please do give us suggestions for any more videos that we must make that can be more helpful to you. Thank you. Good night. Take care. Allah Hafiz.